we should look at healthcare as not a monolithic industry by itself and how does Salesforce works into it. We should look at healthcare also as an industry that needs to evolve with time.
Welcome to the Business of Healthcare podcast from the Center for Healthcare Leadership and Management at the Naveen Jindal School of Management. Here at the University of Texas at Dallas, we bring together business leaders and other forward thinkers to discuss how best to meet the challenges of a rapidly changing, increasingly complex healthcare ecosystem. I'm Dr. Bob Kaiser, Director of the Master's Program in Healthcare Leadership and Management. Be sure to subscribe on Apple Podcasts, Spotify, or your favorite podcasting app to ensure you don't miss any of the future episodes. You can also join us online at businessofhealthcarepodcast.com. Today, we have a very interesting guest who is leading a mission to reimagine the business of healthcare. I can't think of a more appropriate topic for the Business of Healthcare podcast. I'm delighted to have Amit Khanna, SVP and General Manager of Health and Life Sciences at Salesforce. Welcome to the Business of Healthcare podcast, Amit.
Thank you, Bob. It is my pleasure to be with you here to discuss the future of health. As a quick introduction, as you said, Bob, I'm GM and SVP for Healthcare and Life Sciences. I lead both our product strategy and go-to-market for all Salesforce across healthcare and life sciences. I'm really excited to be here and talking to you today.
Well, I'm confident that most of our listeners, they're familiar with Salesforce. I mean, for over 20 years, Salesforce has been providing a suite of internet-based business applications for sales, service, and marketing. Most of us, though, we're not aware at all how this enabling technology is being used in healthcare. So, we see a lot of disruptions across the healthcare industry. Our patients or consumers, they expect more. There's new delivery models. There's things at home health and other ways of dealing with healthcare. A lot of these different things are coming to life now. I know that the administration costs are increasing and operating margins for a lot of places are decreasing. And we have all this new technology that sometimes appears frightening, like artificial intelligence. All of this is happening in a $3 trillion industry. What are your thoughts on some of those topics?
You very well put it, Bob. A lot of challenges, but also exciting times, I feel, in healthcare. And I compare healthcare to every other industry. I feel healthcare is part of every company, whether you're an employer providing care to your employees, whether you're a consumer goods company, whether you're manufacturing, health happens everywhere. That's one thing we should keep in mind. Second, it touches all of us. All of us are involved in it. It touches all our life. It is part of our system. It is the biggest part of our GDP today in the US, at least, and it is 20% of the share. Now, when I look at some of the exciting things that you mentioned, Bob, I'll separate them in two parts. We should look at healthcare as not a monolithic industry by itself and how does Salesforce works into it. We should look at healthcare also as an industry that needs to evolve with time. The relationships, the customer centricity, the focus on delivering value to the customer, the concepts that we have seen and heard from other industries definitely apply to healthcare. And that's why to your first question, why Salesforce and what we are doing, and that's what the fundamental thing Salesforce is looking at in our history of 20 plus years. How can we apply the principles we learned across other industries that are actually relevant for healthcare too? And we'll talk about some of them hopefully today. To your second point about new technologies, I think new technologies always have an ability to disrupt what we have today, but we also need to be careful in healthcare, specifically because it's about giving care. So this idea of trust, ability not to just experiment technologies, but have trust in them when they're fully proven, because we are dealing with lives of people. So it's very, very important for us. And that's why we at Salesforce take a fundamental view of trusted relationships as the first tenet for the company, which means all our products, we put that thought in mind so that healthcare, even though applying concepts of CRM and what we've learned in other industries, is trusted relationships at heart. And at the first time we apply those trusted relationships also to the technology we bring to market. So Exciting times, but trusted also.
Consumers, they're expecting more. I think that's an understatement. In our education program here, we have executive education program at UT Dallas, and we offer an MS in healthcare leadership and management. And we highlight how fragmented the industry is by showing a YouTube. It's entitled, If Air Travel Worked Like Healthcare. If you haven't seen that, I'll repeat the name of that again. If Air Travel Worked Like Healthcare. And it's so funny, but it's so real and so scary. The scenario is there's a traveler's on the phone with a reservation agent, and it progressively gets worse. It shows the airlines aren't working with the other airlines. You need to have a fuel list to manage your fuel, and that's billed separately, of course. Luggage is managed by a different provider. The cost of travel's hidden. They use fax machines to communicate. All the records are securely stored on low acid paper and fire retardant cabinets. The system's insane. And it concludes by saying that's the way it has to be because consumers don't understand how complicated it is to travel. So is that the true statement for healthcare too? I hope not. So how is Salesforce reimagining the business of healthcare?
I think that you're 100% right. Let me take that first. Well, healthcare is broken, period. There's no excuse for us to say, oh, consumers do not understand it, or we have so many laws and hence it's complex. I do not trust those. I feel that we need to have the mindset and the ability to lead the change, and the change will happen. Now, going back what Salesforce and how we think about it, we fundamentally want to think differently about healthcare. We want to see it as customers. We are the customers of the healthcare system. To your analogy of air traffic, we are customers to those airlines. So the same scenario should happen for customers to providers, customers to health plans, customers to pharma companies. If we change that mindset, what do you as a customer expect when you buy at retail, consumer goods, or airline, for the example? Clarity on the price point, service you will get, the quality of service you will get, and the optionality you have if you don't like the service. And I think if we apply those fundamental principles to healthcare, we as consumers want the same thing. We saw during COVID that we got virtual care. The video demand went up just because of convenience, but that's coming up. So customers do it. And to be honest, we did not see that demand before COVID, but during COVID, it completely changed, which means our systems can change. If we want to change, we can change. So ability to provide virtual care within 2 months, a lot of providers came up and provided video visits, which means we can change. So I feel that consumers' demand can change. And so with that, if we look at Salesforce, that's a fundamental tenet for us. Then we look at that relationships are there. You want a relationship with your provider, you want a relationship with your health plan, but they should be trusted relationships, which means they are relationships that help you advance better health outcomes. They should be better related, longitudinal. So that's a second part of our tenet, that healthcare has to be longitudinal, connected, and not episodical. So today, a lot of healthcare is episodical if you look at it, and we need to avoid that episodical part. And lastly, you fundamentally mentioned fax machines. It's still part of the system. And I will give you an example anecdotally. My referral for a specific scan was lost in a fax, and I'm still waiting for 3 years to get my appointment. Would you see that, oh, my fax to the airline got lost and hence I cannot go on vacation for 3 years? No, that's not. So we have to change that. And I think technology is there. There's a lot of things that we are building and bringing to the market. We have to start thinking differently, and the change will happen. If we do customer first, change will happen.
You mentioned, $3 trillion industry. That's probably about the GDP of the country of Germany. And the waste that you find within this industry, how do we go about looking at lowering the cost and increasing productivity? And, there's a lot of, health equity issues that have to be dealt with.
Yeah.
That's a complex problem to solve. And, rethinking and reimagining and really reconsidering the approach to this whole thing, it's an overwhelming task. I know that you've got personal experience and background in enterprise resource planning, the old ERP stuff. And, we've seen a history of electronic health records starting to emerge. And we've seen the history of, customer relationship management. Our audience may not realize, but the CRM business, it started off back in the 70s when you had database marketing and mail lists. And then the PC finally gave us a contact list. And then Salesforce automation kicked in, and it just grew and grew and grew. Now you've got social media, the cloud, mobile, and all this stuff. And the same thing with electronic health records. That started up. How did that get going? People were first just looking at medical records for a single hospital or a healthcare. And then it kind of grew up beyond that, got bigger by dealing more with not just medical records, but health records through multiple organizations. How do you see the client relationship manager technology and the electronic health record technology working together? Does it work together? Does it compete? What's your perspective on that?
You brought out great examples, Bob. Actually, they are complementary. And in my mind, I kind of put them as ERP, Enterprise Resource Planning, with CRM. If you look at, I'll take simple example, and then I'll relate to healthcare. Let's take an example of a retailer trying to sell something on the website. There's a shopping cart. That shopping cart experience of bringing you to the website, ability to see the prices, compare the reviews, ability to find the right product, put it into the basket and order for it is one part. But behind it is the inventory management, the supply chain management, the accounting of it, who is building what. So that whole process gives you end-to-end in a retail environment. What does it mean? The first part in my mind, if you look at it, this whole idea of experience of the consumer, the shopping cart, the website, ability to get to it, knowing what to buy, is the CRM business, the customer relationship management. The inventory, the supply chain, which as you explained, ERP, Enterprise Resource Planning, is the back end, making sure things do happen. What consumers demand, you can provide them at the right price point, you can fulfill at the right time, you have the inventory and you have the stock. Let's take it and put it back to healthcare. Let's apply the same thinking. In my mind, simply EHR records are supply and demand of this. When you are in the hospital, when you are there to get care, they will get the right provider, the right nurse, the right bed, right medication, the right care journey. So that's part. But when you are before or after it, what happens? How do you know which provider to go to? What is the time you should go to? Which is the right provider to go to? What are the places that you can? That is your CRM part. Should I go to the same website to buy because I've got convenience? Yes. Should I go to the same hospital because I got conveniences of omni-channel? They take care of me. They know my family. They know my family history. They can reach out to me. I get appointments. So that's the CRM part. So we as CRM equal to the CRM in retail world, but now replace the ERP, Enterprise Resource Planning of a retail or consumer world, with the EHR that makes things happen. So that's why it is complementary. So we think as CRM, which is a part of pre and post the experiences when you get the care in the hospital, which is delivered by EHR or EMR, but then you connect the dots. So once you're out of the, let's say, hospital, you might need a home health visit, you might need a physiotherapy, you might need to connect to virtual video, you might need to even talk about social barriers to care, like you lack transportation, you want somebody to visit your home after through. That's the part CRM does. So that's how we think of it as very complementary. They serve the similar example in retail where CRM and ERP work, same as CRM and EHR work, system of record, system of experience.
Well, we've seen similar type situations, Amit. I remember the days when we were merging telecommunications and computers. They were traditionally separate technologies and services, but now they're all integrated together. You've got the Internet of Things and you've got 5G communication almost everywhere. And it takes time for that to happen. But my thought would be is that ultimately the electronic health records and the CRM, client relationship management tools, would start to become so integrated and so organized that we really see a true benefit from that. And my next question here is really, it sounds all good, but in the healthcare world, we have a tremendous amount of regulatory compliance. How do you make all these neat things work together and still maintain any sense of regulatory compliance?
I think, Bob, if we put our thoughts in, and I'll give you two specific examples of it, if we wanted the regulatory compliances part, which are defined for the benefit of the consumer, to be honest, we can still deliver with those compliance and give you exactly what as a consumer you need. I'll take one specific example. In US for example, we talk about HIPAA, which is the privacy law in US for healthcare. And we say, okay, because of HIPAA, we cannot do X or Y, or we should not do this. What approach we have taken is we have said we will be HIPAA compliant day zero. It's an infrastructure layer. You can have the basic infrastructure layer done. You don't have to worry about other. And then on top of it, you can deliver engagements. An example is we were talking about, we'll take a very specific example. How can a care team collaborate with you or inside the hospital as an example? We took out Slack seems to be a very good example. Slack is all about collaboration. A lot of people use it. So we said, okay, we can bring Slack. Okay, is there a challenge with HIPAA? Okay, actually, there's a very small thing. What we need to check is the data pipe, the data that flows between two systems, that pipe should be secured. That's what is needed, basically. And if you do that, you have a consumer grade experience in healthcare. So I think we have to look at the law is written both for intent for the consumers to get their privacy honored, but also we should make sure that we apply the law not to block us, but to make sure with the law we can deliver consumer experiences. I think sometimes we take that, oh, because of the law we cannot do it. I think the law is for consumer benefit and privacy, and technology can still work within those boundaries.
Couple areas that I think of when I think of Salesforce. Obviously, predominantly, I think of, the client relationship management. But when I look at all these different systems that are out there that are not connected, and that's a pervasive problem throughout healthcare. How do you interconnect networks and all this information? These application peripheral programming interfaces, rather, APIs, I think that's what they're called. They connect other systems together. And Salesforce, you've got a pretty strong offering within that area, don't you?
Yes, definitely, Bob. We do. So there are two things we do. We have a strong offering with MuleSoft, which was one of our acquisitions a few years back. We actually took MuleSoft and we said we will embed in our healthcare technology, which then integrates with other systems, but also on industry standards, which is the FHIR standards as an industry standard, FHIR, which is the industry standard to exchange information. So I'll just give another example. If you take few decades back, the same problem happened in retail and consumer goods. They were saying, oh, I have to send orders. I don't know which systems. There are multiple ordering systems. How do I send that? They developed an order interface, a standard way of sending and receiving orders. And then systems between retailers and manufacturers started working fine. The same place we are in healthcare. If we all as parties agree that we will adopt this FHIR standards, then the idea of interoperability and the pain that we are seeing will go away, because we will all send message in the same format, understand in the same format. And we have taken the approach as Salesforce that whatever we build and deliver will be on this industry standard that allows very easy integration. Nobody needs to understand our technology. They just need to understand. If I understand FHIR standards, I can exchange information with Salesforce, period. That's how we have simplified it.
We should have you come to our informatics course, because we talk about that FHIR interface. And we talk a lot about the cloud. You've got a health cloud, don't you?
Yes, Bob. That's a product for the healthcare industry where we talk about FHIR standards, integration with EMRs, and making sure we have consumer-grade experiences for health and have longitudinal relationships outside the hospital so that we can partner with EMRs and exist together.
This episode is brought to you by the Center for Healthcare Leadership and Management, the definitive resource for healthcare management education in North Texas. The center is based in the Naveen Jindal School of Management at the University of Texas at Dallas. It plays a unique role in training the next generation of healthcare leaders to meet local, regional, and national demands. The Jindal School uses its strengths in accounting, administration, finance, marketing, and information systems to educate highly qualified personnel for healthcare administration and executive leadership positions. The center is home to 7 healthcare leadership and management programs, including undergraduate and graduate programs, as well as executive programs for physicians and working professionals. For more information, visit us online at jindal.utdallas.edu/healthcare.
We have a word we use to describe this healthcare industry. We call it a kludge. A kludge is defined as an ill-assorted collection of parts. assembled to fulfill a particular purpose. And we write papers on kludgeography. Basically the health system is just a history of kludges. And it's hard. It's really hard to undo a lot of these things. So you have to find ways to work around it and integrate and make it work going forward. We had a podcast called The Long Fix. It was by Vivian Lee. She wrote a book called The Long Fix, and it talks about all these different problems and how long it takes for us to, get these things to converge, and we just can't fix it all overnight. But there's something new on the horizon now. We hear a lot about it. And we mentioned earlier that artificial intelligence, it appears frightening. So how does AI fit into your solution framework? I think we could probably talk another 15 minutes just on that subject alone. Give us some insights on how artificial intelligence can help or hurt or work with in the healthcare industry.
Very valid topic, Bob, and we have seen a lot of excitement in the last 6 months on concept of generative AI, large language models, as people call it. But let's take a step back and think about holistically what is AI and what it can do. These are all new technology, but at the end of it, I always think of it business, which is to deliver better health outcomes at lower cost, doesn't change. Technologies come and enable that. It's the same as if you look at 20 years ago, .com era came in. Business did not change. We just had new technology for customers to buy the products they want. So the fundamental thesis remains the same. So with that thesis, if we go back, what are we looking at? We're looking at how do we reduce cost, how we can make your experiences better, and how can we make it in a trusted, compliant manner that we don't end up in making your healthcare or my healthcare data available publicly on the internet, or misuse or guidance that is not aligned, because we're talking healthcare here. From our perspective, we have taken two approaches. We have been in the AI industry, which we call as a product as Einstein for us for many years. I'll take one simple example that we have done, and we all can actually associate to it. If you go to your provider's office or doctor's office and you have an appointment, the doctor's most likely, at least for my experience, runs late. And they give you 10 minutes, 15 minutes waiting. The reason most of the time is they are double booked, triple booked, because they do not know who will turn up and who will not turn up. So they just double and triple book. If all three of us turn up, their whole day is messed up because they run back late, basically. So what we did is 3 years ago, we said, this is a no-show problem. Take an airline example, Bob, again, to your point of learning from other industries. Airlines have the same problem. You go to the airport, sometimes they say, we're giving a $500 voucher for anybody who would like not to take this flight, but take another flight because they have overbooked. So if we apply that same thesis, what we did is with intelligence, when a consumer is trying to book an appointment online, which is also very new in healthcare, that I can book an appointment without calling somebody, we try to give an example both for the call center agent who's booking an appointment for you, or for you, even though the appointments are available, we think or recommend this slot for you. And that's what we call as learning from intelligence and saying, Amit's profile, knowing Bob is such a similar profile, past appointments, and making sure that we have effective outcomes so that we reduce waste in the system. So that's one part of intelligence. But as we go into the newer side of the house with this generative AI, I think it will definitely reduce a lot of overhead in the healthcare system. But I feel that we need to be very, very careful because this is about health. It is about personally identifiable information. It's not about recommending 5 new products to you. It is about health. So the trust and the ability to know where the recommendation is coming from, why you're recommending, ability to cite that information, ability to point to the sources and trust in those sources are really, really critical for health. And yes, it will change a lot of things. For example, you can apply Gen AI to do some kind of contract generation, which a lot of hospitals and their providers and vendors and all this. But we have to keep all of it in mind that we have to trust it. We don't have to get overboard with this in technology that we lose this idea that this is a highly sensitive information and needs to be appropriately used. And we don't have rights of taking our patients' data and throwing over the internet. We have to be very, very cautious about it.
Yeah, I think there's a lot of low-hanging fruit there, probably just in billing and claims processing, thinking about some of the administrative, shortcuts that can be taken if you use some better algorithms and better review of data and management of data. There's so many things I think that could be improved. The time has arrived for it. Obviously, like you said, we want to make sure that we're creating value with it, not creating chaos with it. There's a lot of things that have to be considered as we stop and look at those type of things. The whole concept here that I'm starting to pick up on is consumerism, that we're no longer patients, but we should be thought of as customers. Now, that's kind of a hard concept to come up with because quite often we think of a customer as a person making a decision to pay for things and to buy things. And, 160 million of us have insurance and they manage and buy those things for us and we don't shop for them. But to change the way of thinking within the healthcare industry, that you start thinking about being a customer, and that doesn't necessarily mean a patient customer, but the providers and the payers and everybody else that's in this supply chain, start thinking in terms of a different motif, a different philosophy. That's hard to do, but I think that's at the basis of what we're trying to do, isn't it?
If we start thinking as customers instead of patients, the whole mindset will change, because customer means I'm serving the customer. I have to give them transparency on the prices. I have to give them transparency on the services that I'm providing them. I will have a lot more competition and they can shop for service. If we change that mindset of healthcare is about serving customers, just like other industries, I think we will automatically start seeing changes, because customer means you have to have the welcome, you have to have the knowledge, you have to have support for every step of the way. I 100% agree with you, and that's how we look at it. We call it, okay, who are your customers? How do you serve your customers? What is you're looking at? That understanding that you have to have customers changes the mindset, and that's what we're trying to bring it from financial services. Financial services calls them always as customers, as clients, as customers. And take an example, retail. So they always treat as customers. So we have to change that mindset in healthcare. And it is also both from individuals like us, we should be shopping more also of services, but also the system allowing us to have that price transparency, that quality standard.
I like to think that these systems will start to evolve in a way that it starts to know me. Instead of asking me the same questions over and over and over again, there ought to be ways to make this more personalized, more responsive, more intuitive, and less frustrating. There's such a level of frustration. And with that, you lack trust. Trust has got to be a key component in healthcare. If you don't have trusted information and trusted relationships, I don't see how we can begin to evolve to the next level. I think that's a very, very important component of what we're trying to accomplish here.
Yes.
So I would say here that looking at the future, the role of the consumer, we're no longer a passive recipient. We actually are wanting to get involved. We want to be an active participant. We want to, be part of the healthcare journey. How do we do that? How do we adapt and take advantage of these tools and really move forward? How do we emphasize, that the patients are empowered now and that we're going to get better healthcare outcomes? I think that's what you're trying to do for us, is kind of lay down a foundation to make that work better. What are your words of encouragement for us in the healthcare audience?
I 100% agree. That's what we are trying to do, Bob. I think we should be very proud of where we are as a country. Last 3 years, even though we saw pandemic as something that we all were going through, I've seen tremendous amount of success and green lights and lights at the end of the tunnel, that we are seeing that change. We are seeing a lot of startups who have come up, a lot of places where we are seeing people are changing the way consumers, like think of all the startups that came up during COVID time that had virtual care being provided to you. It was like, okay, I can pick up and search and I get a primary care doctor online immediately. I can talk to somebody, which was not the case before. I'm seeing a lot of interconnectivity coming in. I'm seeing a lot of people adopting the FHIR standards. So I think there is hope, and I'm seeing that immense progress, even though it is slow, I would say, but there is progress that we are seeing. We are seeing things like doctors are knowing me. I have the records. They don't ask me my date of birth again. At least my doctor doesn't ask me my date of birth each time I go in. They at least know me that part. I think we are seeing progress, but there's still a lot of work to do. And that's why we are thinking about an example is how do we connect the health ecosystem? How do we get to the situation that when a member or a patient or a customer, anyone calls into the healthcare system, you know them. Just like a financial services firm knows you when you call, like when you call the bank, they know you. Same thing has to experience in health. Like, what if I call my provider? The call center agent should know, okay, Amit's profile is this, upcoming appointments are this, Amit is at certain age, he should need some vaccinations. This is what I need to tell him, and I can book the appointment right away. So we have to go from reactive to proactive. Our system is not proactive yet, I feel, because we don't see that proactiveness happening. So we have to get to the point, and that's what we are trying to say, okay, can we get to the point where it becomes more proactive, which means automatically costs will go down, automatically our healthcare system will improve, automatically our citizen health will improve, because this is what we are trying to be proactive. And that all will come by being the data, the intelligence, and finally the CRM piece of it, because you definitely need client relationships, you need customer relationships to get to the point where you can say, okay, I want to engage with you. Here is I'm putting you in a marketing journey for you to remind of certain things you need to do. Or if you call me, I will know you who you are. I will actually know your household, who you are. I will know your kids because I know you, and hence I can offer you advice. So these things, like if I call my provider and if they know me and say, oh, by the way, you have a daughter at home. We have a flu season coming up. Should I schedule a vaccine for you and your daughter and your spouse at the same time? Because they know me. It should not be one-off transaction. That's the place we need to go. And that's what we are trying to do, that understand the human, understand the family, bring the household together, because a lot of care is given at the household. If you don't involve them, you're losing a big place to get better outcomes.
I know that Salesforce has done a really good job of providing education, getting people to understand and appreciate what needs to be done and how to go about doing it. In all of your industries, you've done that very well. Do you have a similar educational profile that you're working on to get people to understand how we can make these changes better take place in a healthcare environment?
Yes, Bob. We have done it already for healthcare systems like provider and payer. Similar thing that we are trying to do with public health. So as what should be the right way, what should we change, and how we can change. One example that we talk about, and going back to your AI and example, I'll quote an example of prior auth. So just for your listeners, in healthcare system today, if you go to your doctor, even if you have insurance and you need a specific surgery, your doctor cannot do it until your health plan approves that. And that approval process is called prior auth, like approving prior authorization. Today, they know, if you look at health plans, if you do a prior auth for knee replacement, they know that 95% of the time you will come back and ask for 4 physiotherapy visits at home. But that doesn't happen automatically. We are saying that change it. It is cost to the system. Can you have an Amazon experience to it, which means when that prior approval comes in for knee replacement, why don't you educate the provider and say, we know there in 95% cases, 4 home therapy visits are needed. We actually approve it right away and have your patient have a better outcome. Just like Amazon returns your money the day you refund it without waiting for it to reach warehouse because of your profile. Why can't we have that in healthcare? That's what we are trying to get to.
Well, that's a noble cause. And it's just, we could go on for another hour here, Amit, really cussing and discussing the pluses and minuses here. But this has been a really good experience, the information you've shared with us. And I'm just so glad that we're able to have you, Amit Khanna, SVP and General Manager of Health and Life Sciences at Salesforce, to help us along this journey. So thank you so much for being part of the Business of Healthcare podcast.
Thank you, Bob, and really appreciate you giving us time, and looking forward to your listeners listening to this interesting podcast.
Thanks for listening to the Business of Healthcare podcast. To learn more about the Center for Healthcare Leadership and Management, go to jindal.utdallas.edu/healthcare.